We were the inventors of orthopedic stem cells in the United States. So when you go online and see some doctor who is trying to do this, that person learned from someone who learned from someone who learned from someone who learned from us. So this is what everyone else has that doesn't do Regenexx. They've got a simple little bedside machine like this. You take your bone marrow, your blood, you put it in here. All the doctor knows is how to do that. Shut the lid, turn on the on button. That's it. Now, obviously this is one size fits all. It's not real complex. The doctor doesn't really know how it works. And the doctor can't customize your sample to what he needs to treat you. So this is the type of processing lab that every Regenexx provider has. The goal is it's a flexible platform through which they can do lots of different things with regenerative medicine. Unlike the little bedside centrifuge, which is one size fits all and only does one little thing. Here is where we actually count cells. Now, again, when you have that simple one size fits all centrifuge, you really don't know how many cells you're injecting. Now that can be a huge issue if you're doing, let's say, both knees, where the doctor may only have enough cells for one knee, but he doesn't know that. And he splits those up in two knees, so the patient gets a suboptimal result. Not at Regenexx, where we actually count the cells and we know the dose. Your Regenexx doctor may have different things that he needs to inject in different areas. Platelet-rich plasma at one concentration versus another to put in different joints or in tendons. A platelet lysate that is just growth factors that might be to go around nerves or in the epidural space. This is what makes Regenexx different. It's not a one-size-fits-all, but a customized solution to what you need. At Regenexx, we're 100% focused on orthopedic conditions. Why? Because we don't want to be a jack of all trades and master at none. Our laser-like focus allows us to do research in this area to improve what we do and stack the deck in your favor. Several years ago, we asked the question, could we get a lot more stem cells than anyone else has ever dreamed of getting out of the same bone marrow sample? Meaning, if we take that bone marrow sample and we throw it in an automated bedside centrifuge that every other doctor has, we'll get a certain number of stem cells out of it. We put our scientific team to work on that issue, and the answer is yes, we can get an awful lot more stem cells out of that same sample than anyone else on earth can get. In fact, that's such a unique process that we filed a patent on that process because it allows us to pick out a second population of stem cells that live in your bone marrow that everyone else right now just throws away. That procedure allows us to get 10 to 20 times the number of stem cells per unit volume out of your bone marrow when compared to smaller automated bedside centrifuges that are used by most doctors. If the processing lab was the heart of the operation, this is really the brains of the operation here. This is the research lab. This is where we take the patented Regenexx procedures and we expand on them. We make them better. We make sure that there's always a better version out there that you have access to. Regenexx is a patented three-part process. First is till the soil, then plant the seeds, then fertilize. Until the soil, we're trying to prepare the joint or the area for your stem cells. When we plant the seeds, obviously we're placing the stem cells precisely under guidance into that area. And then fertilize, we're just adding in nutrients to make sure that your stem cells can do well in the body. This is where we can measure up to 25 growth factors and cytokines in the synovial fluid of someone's knee. Basically trying to look at the soil inside that knee for our stem cell seeds. The reason? Because just like a good farmer, we want to make sure that the environment in there, the fertilizer, for instance, is correct. Now, no one else does that. They just take their stem cell seeds and throw them in there. They don't know if the soil is good, bad, or indifferent. But not at Regenexx. Our focus here is to go beyond where everyone else is. No one else is spending the time to do anything like this, and that's what makes us so different. Unlike other clinics that are just learning how to do this, that might have taken a weekend course, we wrote the book on all this. We've published more research in this area in peer-reviewed medical journals than any other place on earth. The Interventional Orthopedics Foundation is a 501c3 nonprofit. One of the things they do is to collect data on Regenexx patients so that we can know how the patients are doing long term. We're tracking thousands of stem cell treated patients right now. We're also looking at things like possible side effects or complications, all done through this organization. In addition to state-of-the-art lab facilities, we also have state-of-the-art injection facilities here. We offer both high-level ultrasound imaging to guide the needle to very specific spots, and we also offer high-level fluoroscopy or real-time x-ray to make sure we're in other spots that require that technology. Often what you'll see in other clinics that are trying to replicate what we've been doing for the last decade or more is a blind injection. What that means is that the doctor has no idea where the needle is going. He has some idea that it might be in the right ballpark, but that's a little bit like using GPS to get you into the right neighborhood, but forgetting that the GPS needs to take you to the right street number. In the same way, it's critical that the doctor use guidance and be experienced in doing that to make sure these cells go to the exact right spot. Now, that's not a simple thing that can be learned in a weekend. It's a complex thing that physicians spend a year or two mastering before they get reasonably good at it. Again, all of that is part of Orthopedics 2.0, moving patients from invasive surgeries to minimally invasive needle-based procedures done with precise guidance.